Hello there, this is Stacey The Baby Maker Roberts, and I am coming to you with an awesome interview today. It is one of those interviews where you listen to it and you just really sit and think and go, you know what? That makes a lot of sense, and I haven't really looked at it that way before. And that's what I really try to find for you in these interviews, is something that can help you look at things from a different way versus what's always kind of being shown to you or presented to you. That's not necessarily the most effective way to be done the same way over and over and over again. Well, today's interview hopefully will be one of those points where you have some aha moments and you can kind of reframe your thoughts around the difficulties that you're having in regards to fertility. And the topic of today's talk is relationships and how fertility issues can impact relationships and what you can do about it to really lessen that impact. And instead of it being a negative impact, and fertility issues potentially even being a positive impact on your relationship. So the person that I'm interviewing today is an absolutely lovely lady. Her name is Amanda Hofbauer. She's a marriage and family therapist, and she's recently had an interest in helping couples who are dealing with fertility issues. Amanda has her master's degree from Adler's University and currently has her practice in Chicago, Illinois. She is a member of the American Association for Marriage and Family Therapy, and she was an absolute pleasure to speak to, and I know that you'll be getting some really good tidbits of information for you going forward to help you in regards to your relationship and or dealing with your fertility issues and hopefully strengthening your relationship as a result. So without further ado, here is my interview with Amanda Hofbauer. Well, hello there, my friends. This is Stacey The Baby Maker Roberts, and today I am truly blessed to have a professional therapist. Her name is Amanda Hofbauer, as you heard in the introduction. And today we're going to talk about different steps for you to help improve your relationship, because as we know, dealing with fertility issues can really have some impact, some significant impact on your relationship. So I want to welcome you, Amanda. Thank you so much for being with me here today.
Yeah, thank you for having me.
No problem. Now, tell me a little bit about yourself, Amanda. Give me a little bit about your background, if you will.
Yeah, so I am a couple and family therapist, and I work in Chicago. I am trained in systems theory, which is kind of a unique way of doing therapy, which means that I view a couple kind of as a system. And so instead of seeing two people with their kind of individual problems, I try to see what problems are happening in their relationship.
Okay, and then address those with different strategies, or what do you do when you identify those problems?
Yeah, and that kind of depends on the what the problems are. But yes, then we kind of work to change that cycle that's happening between the couple. So often, couples are stuck in cycles that no one really starts. It's kind of, I react to you and you react to me, and we go on and on and on, kind of in a circle.
Right.
And so that's kind of where we want to intervene, is how can we change that cycle? How can we change that circle?
Yep, that makes a lot of sense. And when we first spoke about doing the interview and I asked you about, what you do in regards, you made a statement to me that I thought was really, it just struck me as not just intuitive, but just it just felt good when you said it. So it was just, you described that your work as looking at the space in between. Now, what exactly do you mean by that?
Yeah, so that I kind of see as looking at the space in between a couple. So like I said, it's not about kind of your individual anxiety or your individual issues from childhood, and that obviously those things play a big role. But I'm really focused on, okay, we have these things, but what's actually happening between you? And that's kind of where I want to intervene, is that space in between. And I often kind of will point to that space when I'm sitting with a couple and say, that's where I'm going to be working. That's my client is really your relationship.
That makes a lot of sense. I love that. It's a great, I don't know if it's truly a metaphor, but it's a cool phrase. I like it. Now, how did you get into working with couples who are dealing with fertility issues?
Yeah, so I was trained to work with couples, so that was kind of my starting point. But then I kind of got into the adoption and infertility world. Adoption has affected my own family, so I kind of that was kind of my entry point, I think. But then I just got really interested in fertility as a couple's issue. I think that it is often treated as a women's issue. And there aren't necessarily a lot of resources out there for men and couples. And so I got really interested in, trying to provide that.
That makes a lot of sense, and you're absolutely right. Most people think it's a female issue when they talk about fertility issues. Even the females going through it, really, we kind of take it on board as like either our responsibility or our fault or our issue, even when there's a male diagnosis. So, research shows that it's really 50-50. I mean, there's, his, contribution is just as important as her contribution. So the health of that embryo doesn't stop after, or the responsibility of his sperm health doesn't really stop after fertilization. It's being shown over and over again now in research that it contributes all the way through. And that makes a lot of sense, really. So now, I don't like to ever really start off on a negative note, but I think this is really important to talk about, that because it's not talked about at all that I see, or very much out there for couples, but it's reality, so I think we need to touch base on it. And what I'm talking about is the statistics out there around couples dealing with fertility issues, and what some of the consequences can be in their relationship if what we're talking about today is really not addressed. So can you speak to some of the research that's out there in regards to those stats?
Yeah, so there's a Danish study by Kjær and the co-authors, and they found that couples who don't have a child after treatment are actually 3 times more likely to divorce or end cohabitation than those who do. So I think that's a pretty strong stat, and I think it really speaks to how stressful this is for a couple.
Totally.
And it's stressful in every way, right? Like physically, financially, emotionally. If you're a spiritual person, it's stressful spiritually, and then of course relationally. And it can really kind of create a lot of isolation for each partner. Creates isolation from others outside the couple, but it also creates isolation often in the couple. And so a lot of times people are kind of doing it on their own, even though they're technically going through the process together. It doesn't feel like that. And it can really bring up a lot of very difficult feelings about yourself and your partner, like blame and shame, anger, bitterness, and a lot of times that's not something we're sharing with our partner. That's something we're kind of sitting with on our own. And so there's a lot of kind of cutoff that happens because we're sitting with things alone. And then, of course, emotional and physical intimacy suffer.
Right. Yeah, I wonder, it's interesting, and I don't know if there's any research out there about it, but resentment I see sometimes in couples, when they're not on the same page. One person's doing more than the other. One person thinks that other person's doing too much, forcing things and all that type of stuff. And at the end of the day, if they become pregnant and have a baby, some of that can be relaxed. I mean, it doesn't just magically go away, but some of that can kind of be relaxed because, they created the outcome that they were looking at, and then their focus changes to being parents. And hopefully working together with that. But the couple that it isn't happening for, and they kind of are moving on, deciding they're going to move on to, away from trying, that, I can see resentment being one issue that potentially could be contributing to the divorce rate. What else do you think contributes to that significant difference?
I think resentment is definitely a big piece, which, by the way, I think that sometimes that resentment can still be around even after people have a child.
Absolutely.
And it's not necessarily talked about, but it can still be there.
Totally.
And that can create problems later on. So I think, those difficult feelings are definitely one piece, that the blame, the shame, resentment. I think the way that the emotional connection gets cut off. So it's hard to maintain a relationship if that is suffering. And then, of course, when that's suffering, physical intimacy is usually suffering also. And so, you can get to the end of this process, and whether or not you receive a child at the end of this process, you might be in a place where you don't even feel like you know your partner anymore.
Right.
And so it makes sense to me that people end up divorcing.
Mm-hmm. Yep, I can see that as well. So now that we know that statistic's out there, and again, we're not sharing it to make anyone more worried. What we're sharing it is to give you that information so that you can be proactive in your situation with your partner, in regards to what you can do to improve your relationship, even during a very significant emotional roller coaster, event or time in your relationship. So let's start kind of big picture. What in general can couples do to decrease the risk of this happening in their relationship and therefore decrease the stress, which certainly can help fertility?
Yeah, so a few things. One really important thing that I encourage couples to do is to really try to be a team throughout this process, throughout treatment, even if it's kind of one person's problem more so, medically. Really, you're on a journey to create a life together, and so trying to make that a joint effort that you navigate together, instead of letting everything kind of fall on one person. And so that can mean lots of different things. One thing I encourage couples to do is to go to appointments together whenever possible, even if it's medically only for one of you, but to really be kind of supportive of the other person and to really be a joint kind of front at the doctor's office and all of that, to engage with the doctor together. So, both asking questions, both being involved, trying to share the logistical burden of making appointments and transportation, all of that. And also, receiving news together or results together, like physically together or over a conference call. So that way one person isn't stuck delivering or receiving news from the other, and you can ask all of your questions because you're both there, you're both talking to the doctor, all of that. And I always tell people, that unfortunately the medical system doesn't necessarily encourage all of these things. And so you may have to really be intentional about it. You may have to say, could we schedule a conference call? Could we, how can we do this so that we can both be on this call? Things like that. Another big piece is I try to encourage people to share your experience of the process and to be curious about your partner's experience, right? So, questions like, what was that procedure like for you? I didn't go through that. I don't know. What was that like? What was that conversation with the doctor like for you? Let's talk about how we both felt during that conversation. And to kind of tell your partner if you're feeling overwhelmed or worn out or left out. I think often we assume that men don't have emotions around this process, and in my experience, that is not the case. And if we give them a chance, they will often kind of express that also.
Right, just because they're not dealing with it, and either side, just because that other person isn't dealing with it the same way that you are, doesn't mean that they're not deeply feeling it in some way, shape, or form. Right. Which is a big part of what happens is often we're not dealing with it in the same way. And we can be kind of out of sync in when we're grieving certain things or when things are happening or how. And so it's important to kind of talk through that. Now, I want to go back to what you said about the couples going to appointments together, sharing experiences together. And that's a great question to ask the other person, I think, that I haven't thought of really sharing with my patients is, hey, ask them, what it was like to go through that, experience. And, sometimes it can be a little bit of a joke, and they can have a laugh and kind of bring some levity into it, especially when, they're talking about the first semen analysis that they've ever given. So, I always say to the guys, I don't know how you get it in that cup anyway due to gravity. So I'm impressed that, that there's any results at all. But, stuff like that where they can kind of share things that, to make, not necessarily make light of it, but to bring some levity to the situation. But, it may be that you and I would go, of course that makes sense. Go to the things together, share the experiences together. But there are some people out there that may be like, why? What's the big deal? I mean, is it really that important? So what would you say to a person that would say that to you?
Yeah, I would say that it sometimes can be an intangible thing, but that support and kind of how you navigate this process will really determine how you come out the other side. Mm-hmm. So whether you have a baby or not, how is your relationship going to come out on the other side? And I think that's an important question. So if you do have a child, great. Well, then you're going to have to be parents to that child, and we know that when a couple is doing well, they parent better. Mm-hmm. If they're not doing well, then that's going to affect their parenting. And if you don't end up with a child, then it's just the two of you that are going to be together. And so what does that mean? How are you going to navigate this relationship? How are you going to heal from this process if you have been so separate throughout the entire thing? And I think that's often what leads to divorce or separation.
Mm-hmm. And I think too, what I have heard over the years is it's not just the man not wanting to come. It may not even cross his mind, and the female sometimes it just kind of does things. She potentially just goes to the appointments, not really. She doesn't really. Not that she doesn't want him there, but doesn't think about the value of having him there, either for her own support, emotional support, or to ask questions that she may not have thought of. And maybe she is kind of, sometimes what I'll see is her, the word isn't belittle, but kind of lessening his importance in the whole situation, so that he doesn't necessarily need to be there. Or, I don't want to bother him, he's working, that type of stuff. But they really haven't talked about it to say, hey, if this is important to you, I would like to come. So, and then from the male point of view, again, being like, well, why is that a big deal? It's not about me. So like you're saying, if they have those talks and they, discuss this with each other, why it might be important, or, how they're feeling about it, I think that will go a long way just for their, relational type situation for the future.
Right. And another piece of that kind of happens maybe outside of the doctor's office is really trying to acknowledge the losses that you endured, right? So there's different kinds of grief and loss, and some of the things that come up with infertility. One is disenfranchised grief. So that means grieving a loss that is not socially recognized, right? Mm-hmm. So there aren't funerals for miscarried babies. It's not the norm to send a sympathy card for a failed IVF treatment. Like, we don't have structures in place in our society to really grieve those losses. Mm-hmm. So that's kind of its own grief that comes. And then there's also this anticipatory grief. So that's grieving a seemingly impending loss. So, maybe you've been through 3 IVF cycles and the process failed at the same point each time. Well, by the time you get to number 4, you might be grieving before that failure even happens. Mm-hmm. And so that can be, really confusing too, because you're hopeful, but you're also grieving at the same time, and that's really hard. And so being able to kind of share that with your partner. Mm-hmm. And so I talk about trying to come up with some rituals around that sometimes. So, maybe it means that every time there's an arrival of a period, we watch a movie and eat ice cream together and just be sad about it together. Mm-hmm. Or, when we have a miscarriage, we plant a tree, or, whatever is meaningful to that couple, but mm-hmm. something that, is kind of acknowledging, like, hey, this is a loss, this is real, we're experiencing this. And trying to share what your experience of that grief is. Mm-hmm. I've had couples in my office where, the wife will say, well, I don't think it really affected him. Mm-hmm. And I'll kind of turn to the husband and say, yeah, that's often what people think, that, men aren't really affected by these things. How has that loss affected you? And men will just start crying in my office. Like, mm-hmm. it's affecting them also. And so we need to be sharing those experiences.
That's such a good point. I talk about grief with my patients, for both men and women. But, I have to admit that I really have mostly talked to the women about their grieving process, knowing that the guys are going through, an emotional issue. But I didn't realize that they broke grief down into, what did you call it, disenfranchised grief?
Disenfranchised grief is one kind,
and the anticipatory
grief is another. Right.
Yeah, those are huge. That is so spot on for what patients are dealing with when they're dealing with fertility issues, because they, it's this kind of, anticipatory loss because for the last 12 months it hasn't happened, or disenfranchised loss that it's another month gone, but nobody's calling them up and saying, hey, I'm really sorry, is there anything I can do? It's just kind of like, oh, another month goes by. And I think it's in the media a bit about miscarriage now. There's a little bit more exposure to the disenfranchised loss surrounding miscarriage or stillbirth. But yeah, that's a huge point. Thanks for bringing that up in regards to fertility.
Yeah. And I also think, so along with communicating around losses, really just communicating throughout the entire process. And I really love the line from your new book, which was, I think it was when either partner, felt overwhelmed, they agreed to talk about it and plan together what their next step would be. And I love that it's all about that communication and kind of acting as a team in that way.
Yep, absolutely. And it's not 100% all about loss. I did a 6-week program that looked at fertility issues and actually what you can gain out of going through fertility issues about yourself and about your relationship. And this talk that we're having today is about one of the things that you can gain. That's a little bit of a nugget that you're having to deal with through all this, terrible emotional upheaval, that there are little nuggets that you can pull out of that to make you stronger and to make you happier in the long term, both individually and within your relationship. And certainly, that communication and drawing yourself closer together through the tough times is a significant nugget to be able to pull out of this.
Absolutely. Yeah.
So now, couples that are struggling because they're not on the same page, you may have seen this in your office, as I've seen over the years, is, she wants to do procedure, or medication, and he's like, look, you're pushing too hard. It's going to happen when it's going to happen. It's going to happen when it's meant to be. Or one of them already have children and the other one, so they kind of are a little bit complacent. They understand that, it would be nice to have children together, but they may have older children, and they kind of know that the other person doesn't really understand what all that entails to have kids, but they're on board to make that person happy. But there clearly is a disconnect between the two of them. They're really not on the same page. What can they do to really, kind of bring themselves onto the same page? Yeah.
So a couple of things I would mention there. One is to, if you're really getting to that point, to maybe just take a little break, a month or two, and really kind of prioritize your relationship, really focus on kind of reconnecting with your partner, because a lot of times when people are at that point, the relationship isn't doing great either. And so kind of creating some space to reconnect emotionally, physically, and if there's still a lot of disagreement or kind of differing views about what the next step should be, I really would recommend couples therapy. I mean, that's a great place to kind of have that conversation. The therapist can help you both figure out what's kind of underneath your position, what kind of beliefs, motivations are underneath all that, and how can you come to some kind of next step. And I think that process can be really helpful.
Yeah, I think so too. I think if you just don't have a relationship where you've been able to sit down and talk to each other, and that's really kind of foreign to you in your relationship, which it is in some perfectly fine relationships, right? They don't necessarily have to kind of, or have had to talk about things that are too emotionally involved. Things have been good maybe up until the time that you're trying to conceive. So it may be very difficult for you to follow the other steps that we've talked about sitting down and communicating these feelings, because you just don't know where to start. So having a therapist to be able to be that kind of middleman, that person, that middle woman, to be able to help you navigate that is really important. And I'm so glad that our society is really shifting in its view of seeing a therapist as not necessarily something that's weird or negative, or means that there's something really seriously wrong, but being proactive about things is really important as well too. So how do they find a therapist that's the right fit for them?
Right. So I would say that in the U.S., there's a website called Psychology Today, which I think is really helpful. They have an online therapist finder, and you can kind of filter by all these different factors, location, insurance, all these different things. So that can make it easy to find someone.
Mm-hmm.
I assume that there are similar websites in other countries, but I'm not positive what those are.
I know in Australia, a lot of times the GP, the general practitioner that they go to will know a psychologist or someone to be able to refer out to, and potentially if there's significant stress that can be covered, some number of visits can be covered under Medicare over there. To deal with the significant stress if it's really impacting their health and their life. So that's
Sure.
one way. But Google is great to find those lists and associations that put all that information together.
Right, and I would also say to look for someone, if possible, who is trained in couples therapy. So sometimes therapists will see couples, but that's not necessarily what they've been trained in or their specialty. And so I always encourage people to look for that. In the U.S., that means you're going to be looking for letters like MFT, AMFT, LMFT. Those are marriage and family therapists who are specifically trained to work with couples.
Mm-hmm.
And if you're looking on a website like Psychology Today, I always tell people to there's kind of a place where therapists can check their specialties, kind of check some boxes.
Mm-hmm.
And so make sure that person has infertility listed, make sure they've got couples listed. But I also say, therapists sometimes we check way too many boxes because there's not a limit necessarily. And so if someone's got 30 different specialties listed, then you might want to really contact them and ask about their experience with infertility or couples.
Mm-hmm.
And most therapists are very open to having a conversation before you actually go in to see them, just if you've got questions,
mm-hmm.
So that you can kind of make sure it's a good fit before you spend a bunch of money. So.
Yeah, for sure. And two things about that is, one, I like the fact that you pointed out the experience with couples therapies, because I've had couples go to IVF clinics and see their psychologist who doesn't necessarily have any experience dealing with couples, but is a psychologist, so they get referred to them. And then what happens is, in many cases, they are, or I shouldn't say many, in some cases, it is really the woman being told, look, you have to, come to grips with this fact that, due to your age, you might not be able to conceive, and, you just have to draw the line and look at egg donation or embryo donation. And it's kind of like, really, what, you're not really helping them deal with what's happening now. Although in their heart of hearts, I'm sure they felt that was the best advice to give them, to kind of let the other stuff go, to move forward. But I think stepping out of that kind of realm and move towards, like you said, couples counseling related to fertility or not, right? Just kind of improving their communication in general about any topic, and fertility issues tend to be that significant topic at the time. The other thing I wanted to ask you is, what if it doesn't work the first time? I've had couples come to me and say, oh yeah, we saw that therapist and, it didn't do anything for us, so counseling doesn't work.
Yeah. So a couple things on that. First off, don't expect everything to be fixed in one session. Actually, the first session is usually mostly paperwork, so I try to tell people to kind of have realistic expectations around that, but it does take time. And so, give it some time. Also, if you really, if you give it a couple sessions and you're not feeling like connected to the therapist, you're not feeling like they're really helping you with what you need, then I would say try someone else. There are a lot of people out there, and so if it's not a good fit, there's no reason to stay. But I will say, before you jet, it might be good to bring that up to your therapist, to say, I don't really feel like this is working. Here are some of my concerns, because they very well may be able to adjust and things might work a lot better.
And if they don't, that's probably answering your question about whether you want to hang out with them or not. That's for sure.
Yeah.
Awesome. Well, this is, I don't want to take up too much of your time, Amanda, so this has been fantastic. I think it's touched enough on topics for couples to understand how important it is, but also to begin working within their relationship to improve their situation, and then reach out for help when they need it. So I really, really appreciate your time. You really shed some light on things for me in our talk, and thank you so much for sharing your expertise with us in regards to dealing with couples or helping couples dealing with fertility issues.
Yeah, thanks for having me. This was great.
Awesome. Thanks, Amanda.
Bye.